Hi, and welcome to this Bitesize Smith & Nephew Wound Club online module on the infection management pathway in clinical practice, which forms part of a series of modules that you can access to develop your knowledge and understanding around infection management. My name is Lauren Olenzuk and I'm a complex wound specialist at Smith & Nephew, and today we will be discussing the infection management pathway in clinical practice. And by the end of this module, you'll be able to understand the use of antimicrobial products in the case study that's going to be presented, and also to understand the role that infection management pathways play in potentially improving outcomes. You can now see on the screen the Smith & Nephew infection management pathway, which helps clinicians to choose the most appropriate treatment for patients in their care and for wounds displaying signs of infection. As a result of following this pathway, the case study that we've presented demonstrates the value of the pathway and how it has impacted the patient outcomes. Okay, so let's look at case study 1. This 80-year-old patient presented with a surgical wound on the upper left leg following a coronary artery bypass graft. Notable medical history included type 2 diabetes and diabetic neuropathy. You can see the signs and symptoms that were associated with this wound on first assessment. Exudate levels at this initial assessment were high, and the patient was also experiencing distressing levels of pain. From the image on the screen, you can see that the tissue was unhealthy, discoloured and friable. The clinician's treatment goals were to reduce the signs of local wound infection. For the infection management pathway, a silver barrier dressing was prescribed, initially for a period of 2 weeks, after which the clinician would reassess. The wound management plan consisted of debriding with a monofilament pad, cleansing with warm water, and application of a silver barrier dressing every 72 hours. At the end of the first week, the decision was taken by the clinician to discontinue the silver barrier dressing as the clinical signs of infection were resolved. The patient was reported to be very happy with the reduction in pain levels and the amount of dressing changes they were having. The clinician completed a follow-up assessment after 20 days, at which stage the wound had reduced in size by 50 mm in length and 10 mm in width, with no wound bed depth. The wound bed itself was healthy and almost healed, with 70% granulating tissue and 30% epithelialization was present, with low levels of exudate. Patient comfort was noted to be excellent during the wear time of the silver dressing, and the patient's pain had fully resolved. The clinician noted the following benefits of using the infection management pathway. It allowed a systematic approach to differentiating between local infection and biofilm. It aided in the understanding of the different approaches to local infection and biofilm. It simplified dressing choice and eased decision making. And when utilising the pathway, the clinician noted that there was a clear and concise instruction and that the pathway has the potential to promote antimicrobial stewardship. Check your knowledge and understanding, try and answer the quiz questions. Brilliant, well done. We've now completed this bite-sized module. Take the time to reflect on how you will take some of what you've learnt today and apply it into your daily practice. Please click on the link to go to the full 15-minute version of this presentation. And once this is completed, you will have the opportunity to download an NMC revalidation form. Thank you for your time today, and please remember to look at the other sections to access additional modules to help you on your learning journey.